What's up guys, welcome back to the channel. I'm doing 3 for 3. I'm doing my third video for my third day in a row. So welcome. For those of you who don't know me, my name is Melissa and I am a PA in the Air Force, and today's video is about teleworking from home. This is my first day teleworking ever. I haven't been a PA for very long. I just graduated school in June. I went through IPAP and now I'm practicing in primary care. For those of you that don't know. So I'm teleworking today and I had a very light schedule. So I was actually able to pull some appointments from another provider because they were having like technical difficulty because they are teleworking as well. So I've did a virtual with 4 patients today. So 2 were scheduled. One was for a deployment clearance. So we just had to repeat abnormal labs and then kind of follow up on a ganglion cyst. And then another patient was the med refill for mental health stuff. And then I had 2 other patients for deployment clearance stuff as well. So pretty much just repeating abnormal labs, making sure that they have a plan of care and that they can deploy. So common questions I ask is if like a patient can run 100 yards, lift 40 pounds and get in full battle rattle gear. So that's a pretty good indicator if they can survive in like an austere environment. So that's pretty much what I'm doing. Clinic started at 7:30 this morning for me. It's now 10:30. I did eat breakfast. My first patient of the day didn't answer the phone, so I was able to just pop over right here in my kitchen and make a breakfast burrito real quick. I just cooked 2 eggs and I had some refried beans, put some salsa and avocado in that thing with the tortilla, and then I was pretty much good to go. And then I just carried on with the rest of my day. So I have 2 more patients. And they're both mental health. They're both anxiety. So we're going to talk about anxiety medications actually for one patient who's not on an anxiety medication, and the other patient was switching from one anxiety medication to another because their symptoms were not well controlled. So pretty much with mental health stuff and when people want help with whether it's depression, anxiety, PTSD, OCD, those sorts of things, for me, this is how I practice. Once they've pretty much have seen like whether it's BHOP, so it's like kind of like pre-mental health in the Air Force. It's not like in the mental health clinic, but it's basically like a social worker or an RN that's trained to deal with like mental health stuff. So I recommend that they see BHOP, and then maybe even seeing mental health like a psychologist or a social worker to talk about kind of whatever's going on. Before I recommend medications, because I think sometimes people can just talk through their problems. They don't need to necessarily be medicated. So I just try to recommend certain steps before we go straight to medications. Of course, if a patient is persistent and they want to be on medications, then it is what it is. I just pretty much counsel them on risk versus benefits, side effects that they can experience, because a lot of these SSRIs or psych medications come with side effects like GI upset, among other side effects. And then there's also mobility restrictions that come with putting someone on a anxiety medication or SSRI type of mental health medication, because we have to prove that they have stability. So they typically cannot PCS, TDY, or deploy for like 90 days. And that's anytime we change a dosage or stop a medication. And then pretty much talk about the expectations of how long it's going to take before you can see benefit from a medication, and it's not one size fits all. So we start with one class of medications, and then we kind of just pick a cousin, and then if that cousin doesn't work, we'll go to the next cousin. But usually we start low and go slow. So we'll start at the lowest dose and we'll titrate up as needed based off if their symptoms are controlled or not. So it's a very lengthy process, and if someone's going to see benefit from a medication, it could be anywhere from 4 weeks, 6 weeks, 8 weeks. So I usually tell patients more toward the higher end of 8 weeks, just so that way the expectations are set and they're realistic. So that way patients aren't expecting to take the medication and then feel great the next day. But I do tell patients once we find the medication that works for them, it does give them pretty good symptom control. So that's pretty much it. I am going to call one of my patients real quick. Obviously I can't record that, but I'll tell you guys a little bit about kind of how it went. And then from there, I will have lunch, and then I have one more patient. And then I'm going to work on some like PCS waivers. So sometimes people have conditions who need to be kind of evaluated and cleared by primary care. And primary care will then recommend whether a patient should PCS to this new gaining location based off if they have medical support at the gaining unit. So I do have 2 of those to work on today as well. That's pretty much it. So I'll see you guys here in a little bit. Hi guys, I'm back. The workday is pretty much over. It's now 5 o'clock. Since we last chatted, I had lunch. I made like a little chipotle bowl with some romaine lettuce, ground turkey seasoned with taco seasoning, black beans, corn, avocado, and some medium salsa. I ate that, I drank some water, and then I finished up with my patients. They were all pretty much mental health patients. One patient had like pretty chronic and severe heartburn, so I refilled their PPI. And otherwise, I also followed up with one of my patients who actually has ulcerative colitis, and so they were having some iron deficiency. But we were able to turn their iron panel around to positive notes or to positive values. So now their iron is completely normal. We ended up doubling their dosage. And then we just checked the iron panels again. I had recommended 2 weeks. It had been a little bit longer than 2 weeks, but their iron panel is normal. But now their kidneys are looking a little different. So I need to do a thorough review of their kidneys. And they weren't able to get the labs done today on base because we have limited capabilities right now. So I ended up sending that patient off base to get those labs done. And then that's really it. And then I did my Moderna COVID training. That way we can educate patients when the time comes. And that's pretty much my day. So I think overall I talked to like 7 patients. 4 were scheduled appointments, and then 2 or 3 were deployment clearances, and then 1 was me following up with my iron deficiency patient. But then I'm going to work on peer reviews. So every month we have to review one of our fellow PA's notes, and we have to review 5 notes, 5 patient encounters, and then we pretty much just have to critique them. We follow a guided template to see whether they met standard of care, and that's pretty much it. I'm going to do some admin stuff tomorrow in addition to patient care. But otherwise, it was really nice to not have to drive to work, and really nice to not have to drive home, because to work, it's 30 minutes and back is 30 minutes. So it's an hour out of my day that I spend driving. So it was really nice to not drive, and then to have all my food right here in my kitchen. And now I'm just going to watch TV. So I telework all this week, and then I go back to work next week. And then I telework 1 more week, and then I don't know what the teleworking status is going to be from there. So, but anyway, I just want to check in with you guys and let you know that this is pretty much my day, and it was actually a pretty nice day. So if you guys like this video and you want to see more, don't forget to give it a thumbs up, and then don't forget to subscribe. Definitely leave comments on what you want to see PA wise. I know someone mentioned they want me to do a video on what fellowships or what specialties you can go into in the Air Force, and I'll definitely do that soon, since I just accessed the website that calls for applications every year on what fellowships are open. So I'll definitely do that soon. Otherwise, I'll see you guys next time. Peace.